Using the head tilt chin lift. Use the head tilt chin lift technique to open the airway of patients without trauma who are unconscious or too drowsy to protect their own airway. Use gloves and a mask to prevent contact with secretions. When a person is unconscious, most of their muscles relax. Their tongue may fall back in their throat and can block their airway. To open the airway, place the person face up on a firm, flat surface. Place one hand on the head and 2 fingers under the chin. Then tilt the head back while lifting the chin up with your fingers. The head tilt chin lift technique opens the airway. A child has a smaller, softer airway, which is easier to block when the neck is bent. Tilt the head slightly back and lift the chin with 1 finger so the child's nose is pointed to the ceiling. Be careful not to tilt the head too far back. For a young child or baby, place a folded towel under the shoulders. This naturally tilts the head slightly and lifts the chin into the sniffing position. The nose is pointed to the ceiling. The forehead and chin are aligned, and the neck is wide and open. After doing the head tilt chin lift, check for breathing. Look for the rise and fall of the chest. Listen for air movement and feel for breaths against your cheek. If the airway seems obstructed, look in the mouth. Remove any object you see with a sweep of your finger. Don't push it deeper in the throat. Suction fluids if needed. Hold the airway open. Do not let the head fall forward because this will close the airway. Remember, to open an adult's airway, tilt the head back and lift the chin. For a child, tilt the head slightly in a sniffing position.